Good afternoon, everyone. My name is Mitaire Ikpen with the Nigerian Television Authority. Yesterday, the Minister of Health told us that more than 40 health workers have tested positive to coronavirus in the last 2 weeks. For me, this statistics is huge for frontliners with medical training, not to mention other frontliners without medical training like journalists, cleaners, and security personnel. So what is the plan of the government to mitigate the risk, the hazards, and the dangers posed to all frontliners in the COVID-19 fight? And we were just told now that 5,000 workers have full insurance cover. Are journalists involved in this? I want to also ask that in the last few days, we've not had patients who have been discharged for coronavirus. Does it mean that the patients we have now are not responding to treatment? A Nigerian just sent this now for the DG of the NCDC that with 1.5% chance of coronavirus spread if everyone wears a mask, a face mask. Does this suggest that if everyone wears a face mask, the lockdown will be lifted? Thank you.
Now, for the health insurance, the Secretary of Government did say that the Minister of Health will say something about it, but not now, because there are still a few I's to be dotted and T's to be crossed. So the time frame for that will not be today, because the details will come out. But it is definitely something in question. It has gone very far. Just a few more details that need to be put in.
What is the plan for mitigating the risk of COVID in persons working as healthcare workers? So here we're really talking about three things. One, training in infection control and prevention, because you need to know how to protect yourself. It's not just about the provision of PPE, which is the second bit, making sure that PPE is available across all the health facilities in the country, and also making sure that the PPEs are used rationally and they're used properly, because you can wear PPE and still contaminate yourself if you're not trained to use them properly. And then finally is the issue of education, being aware of the risks as a healthcare worker and making sure that you protect yourself, knowing the high risk situations that you might find yourself, especially with regards to people presenting with unusual symptoms of COVID. Thank you.
Also, the questions of discharge. Yes, there are persons who are due for discharge. Before someone is discharged, he must test negative 2 times. The first time you do a test, they are negative, and then you wait about 48 hours, do another test. When the result comes out, they are negative again, then they can go. So because of that, you don't have people just coming out being discharged anyway. You observe that they are discharged generally in batches. So a group of people test negative 2 times will be discharged. So the process is on. People are getting well, people are getting better, and there is no need to conclude that it's not happening.
On the question on discharges, this is data that is coming in from many centers around the country. So sometimes it's, it takes a while to get data in. From the labs, it's a bit easier to get that data in. So we'll keep updating the numbers on discharges as soon as we get them. There was a question on masks and lockdown. So whatever happens, the mask can only be used in conjunction with everything else. So the mask is not a silver bullet, and this is something we've been emphasizing as much as possible. So the masks are an additional measure to everything else we've been doing, and we have to continue doing those things together. So yes, we have all started using masks whenever we're outside, but please don't stop washing your hands. Don't stop your physical distancing. Do all of them together. It's only by doing it together that we'll get the effect that we want. So thank you very much.